One of the reasons I went into aesthetics is I didn't really like the aesthetics industry. I didn't like the way things were done. But what I will say is because it's $1 trillion industry, there is some incredible, absolutely incredible products and research and development. And actually, if it's done by the right hands, you can get incredible results with really, really subtle rejuvenation. And I can see people's confidence just absolutely grow. So without further ado, I'm going to hand over to my husband, Dr. Peter.
So yes, facial aging in the perimenopause. Unfortunately, there's a little bit of an acceleration in facial aging through that period of your lives. And the reasons for this are skin thinning, skin dullness, and accelerated volume loss. And the accelerated volume loss does cause the mid-face to drop a little bit, and you get a bit of lower face heaviness, which we all generally notice. We talked about the aesthetic triangle in the past, and just to touch on it again, and people may have heard of it. Whenever you're 25, you've got lovely mid-face volume. It's all cheekbones and shadows and reflection and jaw shadows and transitions into the neck, all really nice. And then as we age, we get that lower face heaviness as that mid-face volume depletes and then drops. So why does this happen? So we talked, there's a bit of overlap, of course, in all these talks, but we do lose the fat in the face and we lose the bone. But bone loss is quite steady through the menopause. It's not bone density, which is different. That was touched on by Nicole. So this is bone loss where the actual volume of the bone deteriorates, and that can be around the orbits or around the nose, around the angle of the jaw. And of course, then the balloon deflates a little bit and there's a little bit more laxity on the skin surface. The fat loss, unfortunately, it happens in this mid-face area in both men and women. So in men, the fat goes down and you look more masculine. In ladies, the fat goes down and you look more masculine. So that's really unfortunate. However, the other big cause of volume loss in the perimenopausal time is hyaluronic acid loss. And we've all heard of hyaluronic acid through serums and lots of different things. Even fish oil capsules have hyaluronic acid, eye drops, everything. But it takes a substantial volume loss around the perimenopause as well. Facial volume loss does happen quite early, around the age of 35, which is a little bit depressing. And around 50 years old or the menopause, it can be as much as a teaspoon or more per year. So 6 mils a year, every year as you get older. It is quite a lot, and it does eventually take its toll on how we look. So there we are, the bone and the fat loss steady, a steady line through, and then the hyaluronic acid just literally drops off a waterfall or drops off a cliff, which is very annoying. So is this bad news for everybody? Well, it isn't necessarily bad news. It does depend on a lot of things. It depends on your personality. It depends on a lot of other stresses in your life. But it certainly does tend to have an effect about you, how you feel about yourself. And I can stop my talk right here if we just banned mirrors completely, if mirrors were completely banned. So, but of course, it does add to the other symptoms. And Shauna talked about a lot of symptoms in the perimenopausal time. And everything then just adds together to create a synergistic effect, and you get a bigger number at the end of it. And it just all adds to sometimes a deterioration in your general well-being. So a lot of people do wonder about, is this okay to treat? And Shauna just touched on that. People talk about vanity, like Shauna mentioned, but is there a crossover between self-esteem, really? Because whenever you get that volume loss and you start to look a little bit more aged more quickly, then it does have an impact on how we feel about ourselves. The other thing I'm really quite big into is aesthetic versus cosmetic. So you see cosmetic clinics, and then we call ourselves an aesthetic clinic. And what really is the difference? And aesthetics is really a philosophical term about how you perceive beauty. It can be anything and anybody, whereas cosmetic is a term that's really to do with the surface of everything, and it doesn't really reflect truly what's going on underneath, whether that's psychological or physical or everything else that goes along with it. So one thing whenever I do consult with patients is they do use this word busy. And before COVID, interestingly, busy was a term that was nearly like a badge of honor for men and women. But now it's just like, I am exhausted. I am too busy. I just cannot get this balance right. And so as a man, I've definitely observed that ladies are in a slightly different boat than men about this. And I always talk about the 24/7 job that ladies have, regardless of whether they have an actual profession or job or career. It's still just mayhem in your lives, looking after everybody that's in your family, whether that's a carer's role with a relative, kids, of course, looking after their husband. He, I'm sure, is a great guy and does a lot of dishes, etc., etc. But you do tend to neglect your own well-being until sometimes you come along and go, now might be the time to look at this. And so it's really nice to have those conversations. But where do you start? And so it doesn't mean that you actually have to do anything. It just means that you have to sort of arm yourself with the knowledge. And it's the same as the hormones. If you can arm with yourself with the correct knowledge, then you can make the correct decisions for yourself as an individual. Nobody's going to force you to do anything that you don't want to do. You want to get knowledge that doesn't overwhelm you, because whenever you Google it or look around at where's the best place to go, can be quite overwhelming. So there is a clinic nearby. This, where I'm standing right now, it's a clinic that is quite good, I reckon. It's not far from here. You might know it. And so we would like you to get some good knowledge from us, never feel under pressure from then you can make decisions that are right for you. And we always like to say that you're the expert in yourselves, and we are hopefully experts in some of the things that we do, or all of the things we do. And then two experts putting their heads together, you can come to some really nice solutions that address your own concerns. And we just want to keep it natural and super safe, and that you're in control of your own journey. So we do a doctor-patient consultation, and it is really good fun, especially for me, because people do this, and then we sort of just chat for a while. And we then come to a decision on what will be the best way forward to help your concerns. But so many people have done this maneuver where they've just sort of pulled everything back up. And what they're doing is just restoring that mid-face volume that we unfortunately have lost as we've aged. So another frequent comment used, obviously, yes, with the best of intentions, nobody's saying it in a bad way about their dear mum, is that they're starting to look like their mum. And with the menopause, it's funny that, not funny, but it happens very quickly. And that's that hyaluronic acid drop off, which really plummets so quickly that you get this sort of aging look really quite quickly. Whereas in your 30s and early 40s, it just seems to take a natural course. So the hyaluronic acid drop off is one of the causes of that. So we want to explore the right solution for you. Of course, hormones are being touched on a lot, and absolutely what you want to arm yourself with the correct knowledge about what's right for you in that direction. Skincare, which is brilliant. I mean, if all you did was skincare, you do an awful lot for yourself. There's dermal treatments, so nobody ever has to touch you with a needle at all. But of course, then there are injectables, so I'll just touch on a few of those. The other thing is that if you do a few things together, again, you'll get this 1 + 1 = 3 effect, and you'll get a better result. And hopefully start feeling a little bit better about yourself. So which one could be right for you? There's anti-wrinkle injections. Some of you may have had them. There's other things like dermal filler we'll touch on, which sometimes people find is a little bit confronting to start with. And then there's other natural things like skin boosters, which are although they're an injectable, they're very safe, and they do some really nice work on the sort of surface levels and collagen and sort of skin plumping. Platelet-rich plasma, I'm not sure if any of you have heard of that, but it's another injectable, but it's your own platelets. from your own body, which are re-injected back into various areas of your body. We'll talk about your face tonight, but they're super safe. And if you have a reasonably healthy diet, it's amazing. The platelets and the plasma have just so many growth factors, and they can do some amazing things. So what we want to do is quite simply flip your aesthetic triangle back. So it's simple as that. Really easy. Well, sometimes it is, but we just want to keep it really, really natural. So this lady's 80 years old. I just saw her last week, and she's had a 6-month journey. She doesn't want to look 25 again. She might want to be 25 again and look 25 if she is 25. But most people just generally want a freshening up that reflects their physical fitness, because there's so many people of this age who are still knocking out 18 holes of golf 3 times a week and are very fit and well. So we really want a nice, subtle, natural look. And you can just see in the second picture, she does have a little bit of lipstick on. And she looks like she doesn't mind getting the photograph taken just so much. The first photographs are always horrible to get done. Everybody hates them, but she's used to, this lady's used to us by now. But she does look a little bit happier as well, which is great. So replacing the volume, there's various injectables that can do that. And at our clinic, our mainstay are replacing that hyaluronic acid volume loss, which can be done through a bioremodeling injection called Profilo, which we'll talk about. And then, of course, there's the little filler chat that we're going to have as well. So bioremodeling, it is very pure hyaluronic acid. It's really, really safe. I always say you could give it to your kids, really. It isn't injectable, but it is just super safe. There's no chemicals in it, but it does an amazing thing because it does 3 things, and most treatments do one thing and then you do another thing that adds to it. But Profilo in itself does 3 things. It does a little bit of volume restoration. It thickens the skin and collagenizes the skin. But interestingly, it reactivates your anti-aging pathways, which is fantastic. So you start a little treatment regime and then you just get a booster forever and ever, and you'll keep getting younger up to a point. I reckon the aging process might win eventually. But it's delivered, it is an injectable, 10 small injections. It's very, very quick, but it is not a filler. So that's what I was just saying there. It does three things, which is great, and that's quite unusual. So this was actually after this lady's first set of injections. She'd come back for her second set. And you can see in the first picture there's definitely just a little bit of skin brightening. This lady's not doing anything else apart from a nice bit of skin care. And you can just see her tear troughs look a little bit more restored, and she looks a bit fresher and more youthful, and even really nice whenever she smiles there. That skin brightening and just that mid-face revolumization is really nice. This lady here, whoa, it was a serious business having a chat with her to start with. But I put this gentleman's picture in because it's not just for ladies, it actually is really good for men. And we can, always very hard to standardize pictures. But what I was interested in with this gentleman is that he was trusting the journey, and he's definitely looking younger 18 months on. It's brilliant. He's getting his boosters. He's trusting the doctor who's giving them to him, which is me, strangely. And he's really happy with the results, but they're nice and gentle and subtle. So I really love Profilo, and I do think that if anybody is interested in the injectable component, it should be considered as part of an anti-aging journey, particularly around the perimenopause. So some thoughts on dermal fillers. Everybody has a little bit of a perception maybe of dermal fillers. Some people are happy with them. They definitely have been, people's opinions have been skewed maybe slightly by what they've seen in the media and on television. But it really is just putting back the volume that you previously had in the right place. And whenever you think of 6 mils volume loss per year, it is amazing what you can do with 1, 2 or 3 mils. So there's a little bit of less stigma associated about it, but we always still want to keep it natural. So we really, with filler, the first thing we want to do is make sure that we never do any harm, and we always want to make sure it's super safe, and that the procedures that we start with are really effective. That safety level is really, really high. And they do maybe multiple things like lift, volume restoration, help tear trough, slight reflection, get a little bit of shadow under the cheekbone, and then you can you really restore that volume nicely. And interestingly, whenever people come in and their lower face might be a concern, whenever you do just a simple thing like restore a little bit of mid-face volume, of course there's other things that can go on that annoy people, but some of those things sometimes melt into the back of people's minds because they are less, the focus is less on them in their mind, particularly if they're on a wellness program with other things as well, like diet and hormones, etc. So a couple of pictures now, we'll just click through. So just some nice mid-face volumization. She looks a little bit fresher. This lady as well, I think a 48 or 49. And whenever you turn to the side views, they really start to look really nice with that transition from mid-face down into jawline and neck. There's another one really nice there. You can just see that jaw shadow coming in really nicely and some of the laxity in the neck disappearing. Really subtle mid-face, just a little bit of a sculpt. And you can see it on the side view, what I'm talking about, but with that little bit of light reflection and shadowing that comes in there, but hopefully still looking nice and natural. That's the other side there. Lips are always a thing. People worry about lips, but they are part of our facial aesthetics. So whenever I think of lips, I don't just think of lips. I think of how they fit into your whole face and particularly your lower face. And we generally lose, or the lips sort of generally evert and sort of disappear, particularly whenever we smile as we age. And there's no filler in this lady's lips. It's just a little border trick to enhance the cupid's bow. And whenever there's no side view on that one, but you can just see a little, I'll go back, where the distance between the nose and the top lip has started to lengthen. And then whenever we do that little trick, the distance between the nose and the top lip shortens and the chin looks a little bit longer, which is very aesthetically pleasing. Also, whenever we're thinking about lips, this was immediately after the treatment, so it can be quite gentle. But again, never usually think solely of lips because you just want to see how it fits into somebody's overall aesthetic. So a little bit of softening of the nasolabial shadow there can really help with that lower face look, which makes lips look better and more natural whenever you restore the volume in them. This one is just a little bit of jawline. Just see that nice little jawline shadow peek in there. So, which is quite nice and natural. So it isn't just about where you actually put the filler in. It's we always look at where we put the filler in, but it's all actually about the overall effect it has on our aesthetic. So that's even from the forehead right down. So this lady, lovely facial triangle already with nice mid-face volume, looks okay. Then you get to the side views, then you get to the transition into the neck and it starts to get really nice. And a little bit of a bruise there, so that does happen occasionally. I'll show you another one later on. So we just want to keep it really, really natural. We want to keep the comments of freshness and naturalness and even a reduction in any negative comments like that you're looking tired all the time, and those comments maybe start to stop, which is a really nice outcome as well. So we still want you to look like you. That's why Shauna calls our clinic, You by Dr Shauna Watts. But of course, you never have to have dermal fillers to look refreshed, and it's just an option. And if you can explore those options and trust a little bit of the process, then it could be something that you might think about. So other treatments, again, sorry about the formatting. If you just look at the skin booster component here, you just see how this skin has started to freshen up and the texturing has improved, a little bit more collagenization and lift. And then this one I thought was a really interesting one because I'm such a good injector. I never bruise anybody. And this is me doing a little bit of practicing. Gives off a solid black eye there. But if you look at my tear trough on the other side, and that has just settled slightly, and that is PRP because I have such a healthy diet. My growth factors are amazing. I'm not so sure about that. It's never too late. Some people do worry that, I maybe wouldn't think about embarking on a journey like this, but it is actually never too late to do some very simple things to freshen up your aesthetic. And this lady's journey has been so interesting after her husband died. She wasn't in a great place, and now she just feels a little bit fresher and better about herself. Actually, she's improved even more now with Profilo, and she was accused of looking in her 60s recently, which is really nice. So it can be quite simple. It doesn't have to be overwhelming. And I just feel that there's always a little formula. Optimize your hormones, use a bit of skincare, enjoy some really nice dermal treatments that work. Think about Profilo, and then think about other things, not necessarily dermal fillers or Botox. There's Ultraformer, face whitening and facelift, and then we've got our new Alma laser. But it's just something, it's nice to inform yourself of the knowledge and then you can make the correct decision for yourself. Thank you very much.
For many years in my GP rooms and with friends and family, I heard the same story. People feeling overwhelmed with the huge array of skincare products on the market. Fears around having sensitive skin, choosing the wrong product, or being sold something they don't need. There are so many people intrigued by the latest trends and anti-aging treatments, but unsure if that would be relevant or actually even help them. And many are feeling afraid of being left looking different, silly, or even having an adverse reaction. As a doctor of 25 years, and of course as a woman experiencing the signs of aging myself, I am proud to have created You by Dr Shauna Watts clinics. Led by myself and an experienced team of doctors, our goal is not to change you, just help you become the most confident version of you. Every journey at our clinic begins with a comprehensive assessment by our doctors and includes photography, skin analysis, a thorough exploration of your medical history, and of course, time to chat about your concerns and desires. Together, we create a completely customized plan, helping you achieve the confidence that you've always wanted. We treat all skin concerns, including redness, acne, pigmentation, sun damage, and all signs of aging. We take a holistic approach and only include evidence-based therapies. So if you're ready to start prioritizing you and exploring what we can do to help, please book in for a no-pressure Planning Your Aesthetic Journey appointment. You will leave with a full written plan and information on any recommendations. Our clinics are based at Foresters Beach and Newcastle, and you can book online at youbydrshaunawatts.com.au. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.